Good morning. My name is Bindu. I'm one of the diabetic educator student from James Cook University. This PowerPoint presentation is regarding an Australian Indigenous person with type 2 diabetes. His name is Phil. I'm presenting this PowerPoint presentation to my senior credentialed diabetic educator who can use when Phil come for his third appointment in the clinic. This presentation also included a session plan and also the key issues for the person in the case study and using an appropriate clinical guidelines and discuss the plan for guiding the education for enhancing self-management based on the key issues identified. The presentation also included a critical topic and justify the reason for the critical topic selected and explain the approach to the education regarding this specific topic. Summary of the case study. Phil is a 42-year-old man with a type 2 diabetes who works as a public servant in a busy local government agency. Phil is a proud Aboriginal man and loves sharing his culture and with others. He was recently referred to the diabetes clinic for education about self-management. When Phil attends his clinic appointments, the majority of first and second appointments were spent speaking about his culture, his homeland, and about traditional foods. On the third appointment, his original referral was revised to assist with directing the conversation. It was identified that Phil has been diagnosed with diabetes for over 10 years and that he is currently not prescribed anything. He says he manages his condition with his good diet and love of life. He is adamant that his doctor is not worried about his condition either, but that he enjoys coming to the clinic here as everyone is so nice to talk to. His pathology results are HbA1c is 64 millimole, ACR is about 2200, ALT is 30, total cholesterol is 6.7, triglycerides are 5.6, LDL is 2.5, HDL is 2. So you can see his HbA1c is elevated, his total cholesterol and triglycerides are also elevated. So his blood glucose is not controlled and also he is at risk of developing complications. The key issues are knowledge deficit about the management of diabetes. There's no information about how he is managing his diabetes currently, no regular blood glucose monitoring and data available, inability to self-manage his blood glucose due to lack of empowerment and motivation, unavailability of his vital signs. The other key issues are lack of understanding of regular follow-up in the clinic, lack of information on NDSS registration, inadequate information on where he lives, if he's got access to equipment for monitoring his blood glucose, if the equipment is working, if he has access to pharmacy. The other key issues also identified are: is he getting any discounts on his blood glucose strips, lack of knowledge around his blood glucose testing technique, lack of knowledge if he is washing hands before checking his blood glucose, does he understand how to interpret glucose levels, lack of information on Phil's diet and exercises. Phil also doesn't have knowledge regarding acute complications and management of hyperglycemia, hypoglycemia, hyperosmolar hyperglycemic state, lack of knowledge regarding acute and long-term complications such as heart attack, retinopathy, foot problems, and ulcers, retinopathy, stroke, and neuropathy. The complications. It is vital for Phil to understand the complications based on his current pathology results. Studies have shown that elevated total cholesterol and triglycerides are independent risk factor for cardiovascular disease. HbA1c indicates that how well the glucose is controlled in last few months and risk of complications if elevated. Phil is at risk of developing macrovascular and microvascular complications. In macrovascular complication, Phil develops atherosclerosis, which results in the narrowing of arterial walls. This is the primary pathology mechanism in the development of macrovascular complications. Macrovascular complications are included chronic heart failure, heart attack, stroke, and peripheral arterial diseases. It needs to highlight that in people with type 2 diabetes, cardiovascular disease is the leading cause of morbidity and mortality rates. The microvascular complications are due to poor glycemic control, which is the nephropathy, retinopathy, hyperglycemia, dyslipidemia, hypertension, and microalbuminuria. The critical topic of this presentation is knowledge deficit regarding regular blood glucose monitoring and recording, and self-management of blood glucose. The justification for this critical topic is consistent engagement in diabetes self-management and regular blood glucose monitoring has been found to be good health outcomes in terms of good blood glucose management, fewer complications, improved quality of life, and a reduction in diabetes-related morbidity and mortality risk. Clinical guidelines from Diabetes Australia website and evidence-based literature reviews are used to provide education to Phil. Before starting the education with the Phil, it needs to understand about Phil's knowledge about his type 2 diabetes. Start with a motivational interview. Start discussion with the Phil by exploring ambivalence about behavioral change and eliciting change of talk. Introduce acknowledgement and reflective listening. Use Phil's own words to elicit his goals, concerns, and reason for change. Education plan and person-centered approach. Education plan is created for person-centered care and focusing on the critical issue for education. Engage Phil with the culture, respect, and holistic approach, including physical, spiritual, cultural, emotional, and social well-being of Phil. Use active listening, explore Phil's preferences and beliefs, identify any barriers to care such as numeracy and literacy. Multidisciplinary team approach. A multidisciplinary team approach that involves the individual in decision making is recommended for Phil to improve outcome and promote self-management. It improves patients' participation, health literacy, and self-management in diabetes care. As Phil is an Aboriginal background, involvement of an Aboriginal healthcare worker, Aboriginal liaison officer, or Indigenous outreach worker or care coordinator is essential in the care of Phil to improve his self-management. Shared decision making also important for Phil to manage his diabetes because it includes his personal values, preferences, circumstances, clinical evidences, treatment benefits, and drawbacks. It is important to motivate and empower Phil for his self-management of his diabetes. Self-management include understand the condition, various treatment options, monitor and review the plan of care, engage in activities that protect and promote health, manage and monitor signs and symptoms of the condition, manage the impact of the condition on physical functioning, emotions, and interpersonal relationships. It is also vital to identify if any barriers for Phil to self-manage his diabetes, such as any physical disability, issues around cognition, health literacy, mental health issues, location and access to services, socioeconomic constraints. Check if Phil has registered with NDSS, assist Phil to register with NDSS if it's not done already. Patient education is also important. Phil should be offered structured evidence-based education program to improve Phil's diabetic self-management. Simply providing written information and brochure is unlikely to change health behavior of an individual. It is also an important factor for identifying the health literacy of Phil to provide effective education because it helps to follow instructions for treatment, it helps with the decision making, and it helps to self-manage. And also it's important to ask Phil's understanding of his glycemic management, ask him what's the take-home messages from the consultation by reflective listening or teach back. Discuss about the risk factors also important for Phil to understand why the blood glucose monitoring and self-management is important for him, especially his cultural background of Aboriginal history. Diabetes and pre-diabetes are nearly 4 times more common in Aboriginal and Torres Islander people than in non-Indigenous Australians due to obesity, lack of physical activity, dietary changes, and aging. Preventing progression to type 2 diabetes. As per the recommendations, discuss with the Phil regarding the recommendations of losing weight. Maintain a 7% reduction in weight. Increase moderate intensity physical activity to at least 150 minutes per week. It is critical to educate Phil regarding optimal glucose monitoring. These are included targets for self-monitoring of blood glucose levels. Fasting is recommended between 4 to 7 millimole per liter. 2 hours postprandial between 5 to 10. Frequency should be individualized according to the level of glycemic control and hypoglycemia. It is ideal to motivate Phil to check his blood glucose fasting as postprandial given his current situation. To conclude, ask Phil's understanding of his glycemic management. Ask Phil what the take-home messages were from the consultation by reflective listening or teach back. Ask for any feedback from Phil, inform about follow-up appointment in 1 month, and remind him to bring the diary of his blood glucose monitoring.